So hello and welcome to our assignment brief overview for physiological approaches in health and illness. I'm going to talk you through the assignment and the learning outcomes and things. As normal, what I want you to do is to think about, how you want to put this assignment together. I'm going to give you an idea of how I would be putting this together and how I would approach this if I was writing this assignment. But it's not this isn't the way that you have to do it. If you feel that there is a more appropriate way to make your assignment flow and comfortable for you, this is the thing that you need to focus on. As long as you've met the learning outcomes and you've identified the learning outcomes within your assignment and you've answered the questions as you're going through, this is the key bit really when we're thinking about that, to actually achieve what you need to set out to pass this assignment. So hopefully you'll find this a useful resource as you're going through. And obviously, like anyway, if you've got any problems, any questions, feel free to message me, to contact me, and we can have a discussion about it. So obviously this assignment, you've got to choose a patient from your practice experience. So this is hopefully, because we're linking to your practice, we're thinking about what you do on a daily basis. Hopefully everybody's chosen condition will link nicely to their practice. It'll link nicely to what they're actually looking at on a daily basis. And hopefully from the research and the writing of this assignment, it should support your practice and develop your role helping a patient who has this chosen condition, illness or injury. And it's a case-based essay exploring the altered physiology and appropriate interventions. So as we said, when we look at the learning outcomes on the next slide, it's really going to help you think about what you are achieving when you are supporting this particular patient. It's only 2,500 words, this particular assignment, so there isn't actually that many words. So you do have to be very careful when you're putting this assignment together that you don't get too focused on one particular area at the detriment to the other learning outcomes. So obviously we've got 3 learning outcomes in this particular assignment. So learning outcome 1 is analyse the basic homeostatic responses to pathological changes. So obviously the key word in this particular learning outcome is analyse. So I want you to give me the key pieces of information, the facts, the things that are really, really important when we're thinking about the basic homeostatic responses to the changes that are occurring within the body. You don't have to go too much into detail about homeostasis, although it might help you to actually throw me in a definition of homeostasis. Definition, we're talking 10 to 15 words, and it's really good to almost focus you on this is what homeostasis is trying to achieve, and therefore this is what's actually happening in response to the change that's occurring within the body. The second learning outcome is relate normal and abnormal function to the presentation of conditions caused by age, trauma, environment, inheritance, and iatrogenesis. Now, obviously, as I've said previously in sessions, what this learning outcome is actually asking you is relate the normal and abnormal function to the presentation of your chosen condition. The age, trauma, environment, inheritance, and iatrogenesis is just telling you what conditions in what areas you could actually pick. So if you've picked COPD, the learning outcome for you would be relate normal and abnormal functions to the presentation of COPD. And then you're going to go into detail about this. Obviously, I'm going to break down these learning outcomes even more over the next few slides. But it's relating that normal and abnormal function, which is the key to this learning outcome. It's making sure that you are showing me that you understand this is what's gone wrong. And then your third learning outcome is evaluate methods of care and management of a specific condition, disease from practical experience. So again, it's evaluate methods of care and management of COPD, of osteoporosis, of atrial fibrillation. And again, the key word in this one is evaluate. So we're looking at the positives and the negatives, the strengths and the weaknesses. We're looking at showing that you understand what's good and what's bad and how these could actually affect a patient. So when we think about our assignments, we're thinking about them as we normally would, and we're talking about, right, so we need our introduction, we need our main body, and we need our conclusion. So within our introduction, this is the point where you would introduce what you're going to do in your assignment, what the key learning outcomes you're going to look at, and kind of tell me the story of how your assignment is going to flow. This is also the point that you can identify your condition. So you can give me some information about what your condition is. You can justify or give me a rationale as to why you've picked that condition. So you need to be talking about why it's relevant for your role. Again, it's an essay, so you can't use I, but you can talk about the author, or you can talk about, in the UK, this is something that is particularly prevalent. You might want to throw me in some statistics or some information about why this is such a key kind of condition for you to discuss. And you'll also want to start to think about introducing me to your patient if you are using a patient case study, to actually help me to understand who this is as we flow through the rest of the assignment. Remember, we only have 2,500 words. So if you want to go into something that's a little bit more detailed, and you want to go into something that's, maybe you're going into the diagnosis, the background, the history, you need to think about actually what information you need to include in your assignment and what information you might want to include in an appendix at the end of your assignment or something like that. So think about what is the key information, because I don't want you to be wasting too many words within your introduction, especially when we've only got 2,500 words, discussing your particular patient or your chosen case study, when actually they're not the things that are going to give you the marks, because they're not part of the learning outcomes. It is important that it's there because it sets the scene and it shows me why you've chosen this particular condition, and then obviously flows into the learning outcomes nicely. But too much information here and you're just wasting words. If you just want to give me a couple of a short paragraph or a couple of sentences, that's fantastic. If you're somebody who wants to go into more detail because it's going to help you focus and it's going to help you discuss the other learning outcomes, that's fantastic. Include it, but include it as an appendix at the end, which isn't part of your of your word count. So once you've gone into your essay and you've introduced it, you've introduced your condition, you've introduced your patient, this is where we're now going to start to actually meet those criteria for those learning outcomes. Now, as I said to you previously, I would do it learning outcome 2, learning outcome 1, learning outcome 3, purely because I feel that it actually flows a little bit better when we're linking into these different learning outcomes and we're going telling the story of our assignment. If you want to do it learning outcome 1, learning outcome 2, learning outcome 3, because you feel that it flows better in your brain to attack each learning outcome in order, absolutely fine. You won't get penalised for doing that. This is just, to me, it makes a little bit more sense of telling the story of the condition, then talking about the homeostatic changes, and then talking about the treatments. So if you were to do it in the way that I would attack it, we're thinking about, for learning outcome 2, that relating, the normal and abnormal function. So you're going to start to explain in some detail the altered physiology of the condition, what's going on in your particular chosen condition. You don't have to discuss the normal physiology, because obviously I'm marking it so you can assume that I already know the normal physiology. But it might help you when you're talking about that comparison or that relationship to actually talk about what's gone wrong and why it's changed. I do want you to think about it from a organism level. So how is it going to affect the person or the patient or the human? But also I need you to take it down to the cellular level. What's actually happening at a cellular level? Why is this condition occurring? What are the changes? I know we looked a lot in the Cancer Week at, what's actually happening in a cell, and excuse me, and the different stages of cell growth, and what's actually happening as far as the different stages for as the cell is changing. But what is actually happening at a cellular level? How is this therefore going to affect the organs? How does this tie into the patient's symptoms? So if you're thinking about something like COPD or asthma, what's actually happening at a cellular level, which is affecting the cells that line the trachea, the cells that line the bronchi and the bronchioles, or the cells that line the alveoli, which is therefore causing the patients to actually present with certain symptoms. So hopefully this should be a nice overview of your chosen condition and what's going on from a patient presenting with certain symptoms all the way down to the cellular level. As part of this discussion, we're then going to start to talk about the changes that are happening in the body with internal homeostasis. Obviously, if a patient is presenting certain symptoms, this means that the homeostasis within the body isn't actually doing what it should do. So what has been changed or what has been affected? And then you need to tell me why this is happening. So if we're thinking about a patient with COPD or asthma, what is actually happening within the body? You've already talked about it for learning outcome 2 at that cellular level. But what's actually happening? The body wants certain levels of oxygen and carbon dioxide within it. What is actually happening because the body can't take enough oxygen in, can't expel enough carbon dioxide, and therefore what is going on within the body at that homeostatic level to actually try and overcome this? Is it something that can be overcome by the body, or is it actually something that we need to think about for our learning outcome 3, and it needs to be part of the treatment or care plan? Another example of this is a patient, maybe if you're looking at diabetes and you're talking about the fact that the normal homeostatic levels of the body is we eat something, the body releases insulin that breaks the food that we've just eaten down into glucose, then it's either used or stored, etc, 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 when you're thinking about your negative feedback loops. But obviously, if our body isn't creating insulin or isn't able to respond to insulin in the same manner, we've got to think about, well, okay, our homeostatic methods aren't working properly. This is what therefore needs to be treated. We therefore need to actually have the addition of insulin for a patient who's diabetic to actually be able to maintain that homeostasis within the body. Then our third learning outcome is looking at that evaluation. So again, our positives and negatives, strengths and weaknesses of the treatments that are available for our patients. So you're looking at discussing the treatments that are available for your condition. What does the literature say? And how does this compare for what was done for your patient? You might want to think about any particular pathways, any policies, any procedures, anything that you actually follow within your role that's going to help you support this particular patient. Think about, we discussed when we've been talking about cardiac rehab and pulmonary rehab, we're thinking we haven't just been looking at the patient in you have this, therefore we'll treat it. We're actually looking at the patient in a holistic manner. We're looking at all of the aspects of the patient. We're looking at that education. We're looking at that support. We're looking at that guidance. Think about your particular care pathways that you might be following. We're looking at multidisciplinary team working. Is there lots and lots of different members of the multidisciplinary team working together to actually support this patient? Have we got nurses, physios, OTs, other therapists working together? Do we actually have support of specialists or consultants or GPs, giving and supporting medication therapy, drug therapy? What is the treatment plan for your patient? Is this current best practice? Is it still set in the past? And actually, there's more contemporary research out there that says we should change this. Think about, the positives and the negatives. Is it the best thing for your patient, or is there something better that could be done? Think about those positives and negatives. When you're talking about medication therapy, discuss how the drug works, the receptors, side effects, etc. But we're not writing a medicines management assignment. There's only 2,500 words for this assignment. So I don't need you to some extent to go into all the ins and outs of the pharmacology, the pharmacokinetics, the pharmacodynamics like you did for your meds management assignment. But you do need to show me that you've got a rough idea of how that medication works to actually overcome or to support the treatment for this particular condition. It might be, if you're thinking back to the diabetic example, you're talking me through why we give a patient insulin and therefore what this is going to do to the body. And it might link back into that learning outcome 1 of homeostasis and the fact that the addition of this particular medication is going to support the homeostatic mechanisms within the body to actually return it back to that balance. Now, the fourth part in this main body is really going to flow into your conclusion nicely. And we're thinking about what was the outcome for the patient. Could anything have been done differently? Could you have improved the outcome or the care given? Or do you feel that actually it was the best top quality care? Did your patient survive? Did your patient die? Obviously, this might be something that you do want to discuss, the fact that you didn't feel that this patient had particularly good care, therefore they died. Big do's, little do's, go into that. Or actually, yeah, this is a brilliant care pathway and they've actually gone from being quite frail after their initial diagnosis to, through all the care, the support, the medications, and looking at them as in a holistic manner, they've actually flourished and they're living a better life than they ever did. So just think about that, but this leads nicely into our conclusion. Obviously, our conclusion is a summary of what you've said. You shouldn't be bringing into any new pieces of information into a conclusion. A conclusion is just bringing all the discussions that you've had within the main body of your assignment kind of to a fruition. So it is kind of that whole almost replication of your introduction. Your introduction is going to say, in this assignment, the author will, and your conclusion is going, in this assignment, the author has, and this is the general kind of summing up point. Obviously, it should be followed by a reference list. We're talking APA, use whatever referencing manner is appropriate. There's loads of resources out there. Contact me if you're struggling. It's expected that there are references made to anatomy and physiology resources and local trust policies. Again, we're looking at the physiology, so you need to bring me some A&P resources in there. You're looking at treatment plans and care pathways, so there probably needs to be local trust policies or NICE guidance or something in there to show me that you've done the research as to what is best practice for the management of your condition. So obviously think very much about what you're putting into your assignment, making sure that any key pieces of information, if you're describing symptoms, if you're describing physiology, that you have used that supporting information to justify how you know this information. Otherwise, you'll just get a yellow line on your assignment with no supporting resources. Think about what you're referencing, think about the information that you're putting down and the fact that you do need to justify this with those supporting resources. So I hope that's helped you. Have a good listen to this, have a look at the module handbook, have a look at all the other bits and pieces that are out there. Any questions, feel free to ask me. We can have a discussion in the seminar about this once people have watched it. And I hope you all have fun writing this assignment. Thank you.